so much, Dr. King. That was amazing, and it's actually quite exciting to see that there are some advances in cancer treatment. I'm going to introduce Dr. June Carroll. I'm just pulling up your slides here. So Dr. Carroll is a family physician at the Sinai Health System, which is just one floor above the genetic clinic, as well as the Sidney J. Frankfurt Chair of Family Medicine and a professor and clinician scientist in the Department of Family and Community Medicine at UT. She actually spoke at our very first Lynch Center Education Night back in 2003. And the reason we did that very first education night was because, in case you don't know, I had this patient who had vaginal bleeding for many years, and her doctor kept dismissing it, and she ended up getting a pretty bad endometrial cancer. So the first year we did this, we wanted Dr. Carroll to talk about advocating for yourself. If you think something's wrong, then try and be able to advocate so that you can get it and screen. And she did a great job, and she's back again. So thank you.
Thanks very much for having me. It's really a pleasure to hear. This is going to be certainly a very different talk than the others, as you can imagine. You've heard that I'm a family doctor, which is true. I have a regular full-scope family practice across the road at 60 Murray. So I'm not a specialist in hereditary cancer or Lynch syndrome. But my academic interest is in educating primary care providers about genetics and genomics and hereditary cancers. So I'm very interested to hear from you in the question and answer about really tips from you about what you'd like to maybe be teaching those primary care providers. So maybe keep that in mind as well. So I'm going to be talking for a few minutes here about some general tips about working with your primary care provider. And then I thought I would move into what I see as unique about Lynch syndrome from the primary care point of view, and perhaps how to handle some situations that may have happened to you in your healthcare. So just talking about maybe 4 or 5 general tips, which are really not particular to cancer or Lynch syndrome, but just tips about how to get the best care for your primary care provider. So I would start with really the idea of setting an agenda for your visit with your primary care provider. So perhaps creating a list of the topics that you want to address and introducing those topics at the start of the visit. Because remember, most of our visits are only 10 to 15 minutes. So it's not very long really to go through most of what you want to talk about. So think about prioritizing what you really want to talk about in a visit, and perhaps asking that most important question first as your first topic. You might say, if you're thinking along these lines, that you have some medical problems or fears or worries that you'd like to discuss. And remember, when your primary care provider hears your agenda, they may also have a different priority, so it's a matter of negotiating what you're going to be talking about at that visit. I think it's important to be honest about your worries and concerns and put them out there at the beginning of the visit. Because there's no doubt that providing detailed information about what you're concerned about really helps your primary care provider get the full picture of your overall well-being and all the factors that may be contributing. So you may want to share information about your lifestyle or about relationships at home or at work that may be impacting your health. And I think if you feel your primary care provider is not hearing you, that in a polite way, it's reasonable to say, I'm not sure you've really heard how concerned I am about this particular symptom or this particular concern. It gives them a chance to refocus. They may not have really heard what you were saying, and to kind of refocus on that issue or explain it a little more deeply. It's important to ask questions to be sure you understand what they're talking about. You may want to repeat back what you think you heard, revisit the issue, ask them to write a picture, write down the information. I'm sure many of you have taken friends with you to various appointments, perhaps oncology appointments, where they're writing down some of the information because it's hard for you to focus on what's being said. These days, it's pretty easy for many of you to access your medical records, so you have a chance to actually see some of your results before you see your provider. And remember that nurses and pharmacists and dietitians are also important sources of information. I'm fortunate to be in a family health team where we have all of these individuals. So if your appointment is short with your primary care provider, you may be able to get more information from some of them. I think it's important to work together with your primary care provider. I'm sure many of you have stories that are probably not positive, and you may be sitting there thinking that this hasn't worked for you, but I think it's important to go into the visit with a positive attitude, thinking that your primary care provider is share your worries, ask about side effects, ask questions about other options. And if you need more time, it's very reasonable to say, I really feel I need more time, can we have another visit about this? Always important to have a record of your health history and all your medications, and I would encourage you to bring that with you to every visit, because it really wastes a lot of time trying to think through, when did you have that surgery, what did you have when, what are you on, and so you don't have time to focus on the priorities that you have. So I would really encourage you to do that and keep it up to date. So what's the same about Lynch syndrome as any other visit, as far as the role of your primary care provider? Well, certainly the primary care provider for you has an important role in making referrals to your specialists, coordinating your care, assisting you to get the tests and the support that you need. And don't forget about other preventative care strategies, because our role really is looking at some of the other screening that you might need that may not be the focus of your particular issue, and your immunization and just your general health care. It can certainly be, I've certainly seen it's often the case with patients who have cancer that they're very focused on that and not on their other health care needs. What's different about Lynch syndrome, you all know this, is that it's relatively rare. I mean, not in your lives, but in the life of your primary care provider. You've, I'm sure, spent many hours studying the medical literature. I think you've probably all become experts, and you're probably much more of an expert on Lynch syndrome than your primary care provider. So it's important to keep that in mind. So I thought I'd put up just a few scenarios you may have faced, and maybe some suggestions of how you might handle it or how you may have handled it, and we may be able to talk about that in the discussion. So the first scenario is you go to your primary care provider because you'd like to have a screening urine test for cytology every 6 months, and your primary care provider refuses. They say that they don't see any evidence for that, they don't see any reason to do that. So remember that we're making decisions that are based on our medical training, our experience, our knowledge of the evidence and what evidence is out there. And sometimes our decisions may seem somewhat unfair or arbitrary. So what should you do in that situation? You could come prepared with 20 pages of internet printout from patient groups advocating that you should insist that your provider order this test. Maybe some of you have done that. I've certainly had that in my office. I would suggest that that's not recommended. It's going to take a lot of time away from the visit. Maybe one good source might be a good idea, but probably not the way to go. I think it's important, though, to have a calm, informative discussion about your concerns and why you're wanting that sort of a test. You heard earlier from Kara about the screening recommendation sheet that they've developed, which I think is a really great idea, and it might be something that you can take with you to your primary care provider. So if we look at the recommendation here for screening for urinary tract cancers, you can see that basically the evidence is lacking right now about whether urine for cytology is a good idea in screening for urinary tract cancers. So your provider is probably going to say that this isn't a good idea. So you're really going to need to think about talking with them about why it matters to you. Perhaps it's a cancer that's been very common in your family, it's something that you're worried about and you'd really like them to think about it. It's important to remember that more tests are not always better, and that any test can lead to another or lead to other kind of side effects or complications. So you have to keep that in mind. It may seem simple to have a urine test, but it can lead certainly to other things. We're aware of trying to pay attention to healthcare dollars, so we're trying to recommend tests that are evidence-based. So second scenario, you have a symptom that might be associated with Lynch syndrome, but your provider says it's nothing to worry about, and I think this is what Melissa was alluding to. But remember, your primary care provider may not have great knowledge of Lynch syndrome and its associated cancer. So for example, the situation of a woman who may be close to menopause, who's having some irregular vaginal bleeding, and her primary care provider just says, well, that's common, you're just perimenopausal, when really you know that it could well be a symptom of endometrial cancer. So what to do? Should you book the pelvic ultrasound yourself? Probably not a good idea. I would suggest here that you do need to be an expert on your own condition, and you do need to advocate for yourself with your provider who may not know about it. Have an informative discussion with your healthcare provider that certain cancers are associated with Lynch syndrome. express your worries and that you would like testing or a referral. And if they still decline, I think, remember that most primary care providers do want to help with their care, so it's really worth engaging them. And this is where this screening document may really come in handy, because you would be able to show them about endometrial cancer and its incidence. Ovarian cancer is another common one that we certainly get asked a lot of questions about screening, not really with people with Lynch syndrome, but with the general public, where people would like pelvic ultrasounds and a blood test for CA-125, and there's really not much evidence that it's of much value in screening. So,
Attention all visitors, attention all visitors. Visiting hours have now ended and you are requested to please leave immediately. Attention all visitors, attention all visitors. Visiting hours have now ended and you are requested to please leave immediately. Thank you and good night.
So that's another one where you may get a bit of pushback if you're asking for that kind of screening. So scenario 3 is you'd like a second opinion and your primary care provider refuses. So here we're in a situation where we actually are kind of the gatekeepers and you do need a referral to see a specialist. So what are you going to do in that situation? Should you call the specialist yourself and book an appointment? Probably not a great idea. Again, probably a better idea to discuss your concerns and why you feel your request is reasonable and why you think a second opinion is necessary. Your provider may have a good reason why they aren't recommending it, but you may also have good reasons why you would like to have it. Sometimes you may reach a standoff, and that may be that primary care provider isn't the right one for you, if they're really not hearing your concerns. So if that's the case, if you need something urgently, you may consider a walk-in clinic or calling Healthcare Connect to try to find a provider that's right for you. Challenging because there aren't a lot of primary care providers, but that may be what you need to do. So the last scenario, you'd like your provider's opinion about complementary medicine that you're taking to prevent cancer. So I'm sure you're all aware of complementary and alternative medicines. Complementary medicines tend to be those that are combined with traditional treatment. So that might be a medication to enhance your healing after surgery. And alternative medicine would be perhaps treating the cancer with the alternative medicine, replacing traditional treatment. So having a different medicine rather than treating with chemotherapy. So what should you do in that kind of situation? Should you stop your treatment because of side effects and try an alternative medicine? Well, again, I wouldn't recommend that without having a conversation. It's really a good idea to bring all the bottles of complementary and alternative medicine that you're taking and ask if they're safe or effective with your other methodologies. It's very common. Many people, I would say, a lot of my patients are certainly taking different treatments for various things at this point in time. So I do like to see what they're taking. If you're thinking about a complementary treatment, you want to make sure it won't interfere with your regular medications. You want to bring it in and talk about it. Remember, your primary care provider probably won't be familiar with these complementary and alternative medicines because we're not taught about them in medical school. They may offer to look them up on a site like I mentioned here on the slide. But you can also talk to your pharmacist. If you're lucky enough to be in a family health team, a number of us have pharmacists as well, so you can talk to them about this. They can look it up for you. You do want to make sure that these medications aren't interfering with your regular treatments. So certainly, if you're having side effects, I think the first step is to ask your provider if there's mainstream medications that might work, and if not, then thinking about some of these alternatives. So I'll just finish here. Really, the picture here is really just that I think it's all about relationships. So it's really a matter of trying to form a partnership with your primary care provider to really get the care that you need and that I think they want to provide you.